What are the deadliest diseases and what is it like to die from them? This week, I'll be covering congestive heart failure, or CHF. If you're new to my channel, I'm hospice nurse Julie. I educate about death and dying to help prepare you and to decrease fear. And I like to talk about specific diseases that I see on hospice and educate about what they will look like when they are at an advanced stage and getting towards the end of life. This is hopefully to help prepare you so you can live better and die better. So congestive heart failure. Congestive heart failure is a chronic life-limiting illness. So you can live a long time with congestive heart failure. It's a very generalized umbrella for a heart condition. We do see people at the very end stages of this disease on hospice. Generally speaking, what I'd say about this disease is it's one of the diseases on hospice that you can come on hospice and come off hospice. You sometimes do get better with this disease on hospice because you're being managed by a healthcare team so well that you start improving enough that you actually come off hospice. Like many of you know who might have this disease or a disease like this, like COPD or Alzheimer's dementia, those are all different diseases, but they're all life-limiting chronic illnesses that kind of wax and wane, right? You're doing well, something happens, an infection or a fall, and you kind of go downhill. You have an exacerbation of this disease where all of the symptoms of this disease get suddenly worse and you have to go into the hospital. And then once you're in the hospital, they say, we think you're declining or your disease is advancing. We're not sure if there's much more we can do for you in the hospital. So maybe you should try hospice. That is when I would see you. And that happens with CHF, COPD, Alzheimer's dementia, any kind of chronic illness. You'll see it kind of go up and down. Many of you watching who have this disease are probably like, yes, that does happen. So just because you are on hospice with this disease doesn't necessarily mean you are dying in the next 6 months. You could, or you could start, going back uphill and getting better, and then you come off hospice. Just keep that in mind. So when I see people with congestive heart failure on hospice, this is what I typically see. Prior to coming on hospice, they have been having a functional decline. So they were driving themselves out and getting groceries and kind of being able to live independently. Then they started needing to get more help with outside things, like someone else has to get them groceries, someone else has to go get their mail. They're kind of confined to their home because it's too hard to leave. Their functional status has declined. They need a walker now. They're more frequently short of breath because of this disease. They may notice that their legs are more swollen than normal. They usually have had several hospital admissions in the past month or two prior to coming onto hospice. And by the time we see them on hospice, they are getting towards the end of their disease. So their functional status is usually homebound. It's very, very difficult for them to leave the home. Very difficult for them to get out of bed and walk to the bathroom and go to the bathroom on their own. Sometimes on hospice, you can do that, and sometimes you do need someone to be there in the home to help you do that. You're going to have the main symptoms I see with congestive heart failure, or CHF, is usually edema, which means a swelling, and it's usually in your lower extremities, so your legs and feet, and shortness of breath. So that's the main symptom I see with CHF, shortness of breath. The edema is annoying, and it can fluctuate as time goes on and depending on what medications you're on, but the shortness of breath is what really bothers most people with this disease. It can come and go. It can get better, it can get worse, depending on how you're feeling that day. The good news is if you are on hospice, we will manage that shortness of breath very, very well. And it's usually with oxygen and just a little bit of morphine. People really hear the word morphine and they get scared because they think of morphine, they think of addiction, they think, oh, you're just trying to drug me so I sleep all the time. But that is not true. And anyone who has used a little bit of morphine for their shortness of breath with CHF knows this, because all it does is relaxes your central nervous system, it relaxes your diaphragm, so you can get that nice deep breath that you feel like you need to get. A lot of times with CHF, your oxygen level can be fine, but you still feel short of breath. So that's a feeling that we call air hunger. a lot of times your oxygen's fine and you probably are breathing okay, but you still feel like you can't breathe. And that's what morphine is really, really good at. And again, we give you little tiny bits of morphine and it takes away that sensation of air hunger. So like I said, at the end of life with CHF, if you truly are end of life and on hospice, the main things you're really going to see are just functional decline, shortness of breath, and swelling in the legs and feet. And again, swelling in the legs and feet and shortness of breath, we can use medication to help with that. A lot of times steroids helps with that as well. A little bit of steroid can kind of help decrease the inflammation, make you feel a little better. Everyone's going to be different, but this is what I generally see on hospice with CHF. And then of course, with everybody on hospice, with everybody who's getting towards the end of their life, they will have functional decline. So you'll also see that. It's going to be harder for you to do normal everyday living stuff. So you'll likely start needing more and more and more help. Help getting to the bathroom, help getting washed, help getting dressed. And that's just going to decline as time goes on. And you'll also notice with any disease on hospice that your person, or you, if you're the one on hospice, will not be hungry and not be thirsty. Usually. The hunger and thirst is going to go down, 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 down. And then your sleep is going to go up, 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 up. And that is normal and to be expected. And I would say everyone on hospice experiences that. It doesn't matter what disease you have, because your body is built to die. Our bodies are all built to die. They know how to do it. They have built-in mechanisms that start kicking in that help us slowly decline and slowly and hopefully peacefully die. And those mechanisms turn off the hunger and thirst and increase your sleep. So that's one thing you'll also see. And then at the very end of life, we go into the actively dying phase. Now, specifically in this video, I'm talking about CHF, but really the actively dying phase will look almost the same with all diseases. And the actively dying phase is that last phase of life. Usually lasts a few hours to a few days, and the person is usually unconscious. Someone will have to be there to change them, to dress them. They won't be able to do anything for themselves because they will be unconscious, basically sleeping 24 hours. They will not be eating and drinking. They will have changes in breathing, so they will be breathing differently, which is very normal. They may have that death rattle. It's actually called terminal secretions. I have many videos about this. If this is the first time you're hearing about it, you can click on those videos to check out what that is. And you'll notice that their eyes and mouth will likely be open because of the muscles all relaxing. So I'm basically just describing to you what it looks like to be actively dying. And it doesn't matter if you have CHF or a type of cancer. Usually everyone in this phase will look the same. And during this phase, all you really have to think about is, are they clean? Are they safe? Are they comfortable? And if you can say yes to all those things, you're good. And you just let their body be the guide. So generally speaking with CHF, there's only 1 or 2 symptoms we really work with on hospice because it's a pretty straightforward disease. And you can live a very long time with this disease before you are on hospice with this disease. I hope this helps. Education helps decrease fear, increase your ability to be an advocate for yourself. And let me know if you have any questions in the comments.